So let's say that we did a re-examination and we would like to print out a progress report. While we are in the List tab area, you will scroll down and go to Patient Letter. So select Patient Letter, and then on the bottom, select New. In the upper right-hand corner of this window, you will see Letter with a red asterisk. You will select what it is that you want to print out and create. And you'll see a number of options, but at the top, we have Progress Reports. So select Progress Reports. Next, you'll move to the left-hand side of the screen, and you'll see Note with a red asterisk. That will create a drop-down menu, and then you can select what note that you want to be able to bring that out of. Well, I want to do a progress report based on that last re-exam that we did on the patient, which is in the examination plan of care note. So we're going to select that, and we select OK. And that brings in our progress report. For the patient, it brings in to the dialog the problem DX, what their established plan of care is, their treatment plan, that we have informed consent on file, shows their long-term treatment goals, when they're going to be reevaluated, and then that reevaluation, pain and functional objective measurement, bringing in the outcome assessment tools that were performed for that date of re-exam, and as well as we discharge from care, apparently in this particular format, with the provider and with the patient instructions. So that is a progress report that can be printed, and you'll see the print icon. And it can be delivered, emailed, faxed, transmitted securely. How do we have a patient sign for a consent for a procedure? Well, we're in the List section tab. We will scroll down to Consent Form. We will select Consent Form and then go to New. And then this is where you would select the type of consent. So these consent forms would need to be loaded in your system. And let's say that we are going to do trigger point injection. We need a trigger point injection consent. So we selected that. We're going to click OK. And then this brings us right to the consent form, which would be explained to the patient. It would document their problem DX, explain the alternatives, risks, benefits, all of that. And once that's completed with the patient, on the lower left-hand side of the screen, you will click that they've given consent. And then on the right-hand side, the first set of green buttons, you will click Sign, and this is where the patient will then sign their name, giving the consent. Now you have a signed consent, and just click OK. What if we need to create a letter of medical necessity for a procedure? While we are in the List tab area, you can scroll down, click on Patient Letter, select New. On the upper right-hand corner, red asterisk by letter, click the drop down, and let's say that it's a knee brace letter of medical necessity. We'll select that. We'll select the note that we want to pull the information out of. And so we're going to select our examination. I think we have some information in there. And then we'll click OK. And then that brings up our letter of medical necessity. It's bringing in the problem diagnosis, talking about the instructions for use for that knee brace, and it's tied to that particular visit. And then that can be faxed, printed for your needs. let's review outcome assessment tools. We're in the List tab. Scroll down to Outcome Assessment Tools. Click on Outcome Assessment Tools, and then click on New at the bottom of the screen. Now your outcome assessment tools can individually be brought into your examination note, or you can keep them all in this section and document the use of that just like its own note. So keep in mind on how you would like to go about that. And so we have the Pain Detect questionnaire. We have patient-specific function scale, pain disability index, headache, neck, revised Oswestry, upper extremity functional scale. We have the quick dash. We have the lower extremity functional scale, patient satisfaction with therapy. We have several balance assessments, and then the PHQ depression tool, GAD-7 anxiety, sleep apnea, Keel Start Back, the clinical Toronto clinical scoring, and a post-concussion questionnaire. So we have these in place currently. If you are currently utilizing an outcome assessment tool that is not on this list, we will certainly be able to add that to the list as a scoring form. And so, again, these can be brought into an examination note once you've selected what you are currently using to be able to provide objective evidence at the initial exam and those re-exams, or you can keep them in the outcome assessment tool section. And if you do that, then when you click on body region, you can state, well, this is for the cervical spine region, and we're having the patient fill out the headache disability index as well as the neck pain disability index questionnaire. And then the patient would simply fill those out, or they would probably fill it out on paper and then somebody would put it in the computer, or this could also be done through the patient portal. But you can see how it is calculating that total score, and then you're allowed to preview that as well. And then it documents it on that particular data service. To perform some administrative functions, we are going to log in as an administrator. So we're putting in our username and password. And if you have been given administrative rights, you'll be able to do this. If not, and if you need to be on the back end, you'll need to get approval from your doctor who owns the clinic or the owner of the clinic. And then we can provide those special privileges. And so I've put in my username, my password, and clicked on administration, and we will log in. Now this brings us into the admin portion. Let's take a look at the vitamin mix template. And so we'll click on Tools. We'll select Template and go to Clinical Note Contents and select that. That brings us into all of the templates. And so we're going to select vitamin injection mix for area, and we're going to select Modify. Now this brings us into the templated version of that vitamin eSTEM note. And so we'll select vitamin injection on the left-hand side, vitamin injection mix, and then everything that we click here when this template is applied will apply into the note. So we're going to click vitamin injection mix because that brings in appropriate information. And then based on the elements and components that you have within your mix, then this would all be customized and created to those. And then the total amount of milligrams that go into the mixture, NCD number, and the like, all of that would be entered in this template. And this is where it would be updated as well. So let's say our total milligrams is 1. We've calculated to milligram per ml per site to be, let's say, 0.0045. All that is calculated, by the way, on an Excel sheet. Let's say that the NDC number, it's an 11-digit number. We're just going to throw in some numbers there. Expiration date, lot number, and then, of course, the manufacturer based on where you buy that particular product. So all of that would be entered in to the template on each particular component. Now, let's say that we got into the template and we need to update. Let's say that the cyanocobalamin has now expired and we've got a new NDC number. Well, in order to make that selection for the new NDC number, you can simply unclick, or you can leave it clicked and it'll bring open the box and you just go ahead and type in that new NDC number. Expiration date, reset it to the new expiration date. Maybe you had a new manufacturer, new lot number, obviously, and you can delete that and put in the new one. But this is where you would update that to make sure that it is up to date and that you have accuracy within your record keeping system for that product used and procedure used for the patient. Once this is completed, then you will simply click done and it's ready to go. Adding CPT codes, you'll go to Masters and Charge Codes. Select Charge Codes. And then you'll see this is where you would add diagnosis codes, CPT codes. We're going to select CPT. If the code that you are looking for is not in the system, it'll show up blank. And if that's the case and you need to add a new code, then you would click New. Then you would type in the code that you want to put in that isn't in there. Next, and you can see the red asterisk, code and description. Next, you would put in the description. We recommend that you use the actual description from the AMA guidelines. And once that's completed, then you would just click OK. To add an ICD-10 code, exactly the same process. Click on New, add the code, add the description, and click OK. Adding history of present illness chief complaints. We would go to Masters, go to Chief Complaint, and then this is where you would add chief complaint. So if there's a chief complaint that is not on here, then you would click on New, add in what that chief complaint is going to be. So let's say it's headaches. Then you would select the note that it's going to come out of, or that you want to use as a deep. Then you would select the note that it would be in, and we recommend that you just stick with the default. And then click OK. And then the headache would appear. Then you can modify, and we'll just open up the ankle one to show you. There's your chief complaint set up that way. And then this is where we can help you customize what you want to be shown as macros within that particular chief complaint. And unless you have certified training for My Patient Care, we do recommend any creation of macros or detail like this to be brought to us to help you with in getting it to customize for your needs. So how do we change a Problem DX or remove a Problem DX ICD-10 code from the Problem DX section? So let's say that we want to remove pain in right knee. And so that's already highlighted. It's been selected. We will go down on the bottom. In the green bars, you'll see the button called Remove. Click on that. And then just above the dark line above concern status on the lower left, you'll see a checkbox, erroneous entry. You can select that and then click OK, and it will effectively remove that code from the Problem DX section. How do we resequence diagnosis codes? And so we are in the Problem DX section, and you'll see a green button called Sequence DX. You'll click that, and this is the area that you can actually grab onto a diagnosis and move it. Click, hold it, and move it. And then once you have that reset, then you'll click OK, and it will resequence those diagnosis codes. Creating a diagnostic order. Within the notes section, you'll see what's called diagnostic order. We'll select diagnostic order. It's right below the DME prescribed. And then that opens up categories that are in the system for what it is that you're ordering. So let's say that we are going to order an X-ray. So we will select the X-ray category. That will open up X-ray procedures that are available in that category. So let's say that we want to perform X-ray cervical spine. Now this can be done in-house, or it can be done externally or by another entity. And so if the X-ray is performed in-house in your clinic, then you'll want to keep in-house as identified, and then this will drop into the charge capture for billing. You can also go ahead and link that X-ray to the specific diagnosis and click OK, and then it's specifically linked already. And then you can click OK. Now, if you're performing the X-ray in-house, you can go ahead and have the patient sign a consent form for that diagnostic procedure. And so to do that, after you've made the selection of the study to be performed, you will select consent on the green button, click on consent, and that brings forward the consent form for the procedure. You will click Sign. It'll bring up the sign-in for the patient. And the patient will sign. And that completes the consent for the X-ray procedure. Again, in making that diagnostic order, always keep in mind, in-house, you will be billing for the procedure. If it is a procedure that's to be performed outside of your clinic and you're making a referral for it, then you can go ahead and click on Other. You can create notes within the system as well. And then within the note itself, it will document that that diagnostic order was made. The clinical patient record. And so this is a tab that's on the left-hand side of your screen, and you can see that it's open. That can be closed by simply clicking on the black dot. And it keeps it out of the way until you move over to the tab to open it up. If you would like to keep it open at all times, then simply click on the black dot again and it will stay open. Now, what does it tell us? Well, it allows you an opportunity to have a quick view, such as the most recent vitals, any clinical alerts that you may have in the system that's been added, your clinical notes, and so this will give you a rundown of all the different notes that have been had in the system, and you can see a variety of examination notes, procedure notes, outcome assessment notes, and so to look at those notes, it gives you a very quick way of doing that. You'll simply hover over the three dots and click on those three dots, and it opens up the section or the note that you selected. That gives you an opportunity to view what the patient has had in terms of exam or procedures within the system. You can also identify allergies that have been documented, their problems or diagnoses, medications that they're on, any special diagnostic orders or tests that have been ordered for the patient, any referrals that have been documented for the patient, same with the labs that could be documented for the patient, lab reports, diagnostic reports, patient letters that have been generated, progress reports, their past medical history can be documented, social history, family, of course, any images, supplies, and patient education, referral tracking. So it's a very quick, easy look at what's been done within the patient record. signing into the iPatient Care platform. Once you've had the opportunity to have the iPatient Care platform loaded in onto your computer, then in order to log in, you will click on that icon and it will bring you to this opening login screen. You will go ahead and type in your username. And then secondly, you will type in your password. Now you'll see below there is a location. And so if you have multiple clinic locations, you will be checking into one of those. And then below that, you will see administration, and next to it, EHR practice management system. If you are a provider and using the system, it automatically does default to the EHR, so you do not need to select it. However, if you have administrative controls and need to get into the back end of the program to make some administrative adjustments or settings, then you would select administration, which would bring you to the other side of the iPatient Care platform, the other side being the administration aspect. We're going to go ahead and select the EHR and log in, and then simply click on login. Now when you come to the login, there is a preference that can be set as to what window you want to have popped open. This one happens to be opening up where you could find a patient chart. However, you can have a preference that will open up to the dashboard, and specifically the tab of the dashboard that you would like to see. So during setup, make sure that you let us know what preference you may have. Now, in the event that you would like to go ahead and set it up later, then you would go to Tools, Preferences, and User Preferences. And then you would select the Dashboard tab to the right, and then you will see how to log into the iPatient Care platform. Once you've had the opportunity to have the platform loaded onto the computer that you will be utilizing, you will click on that icon and it will bring you to this opening login screen. You will type in your username, and then you will type in your password. Secondly, you will take a look at the location. If your clinic is in multiple locations, you will want to select the location that you are working in. And then lastly, it will automatically default to bringing you into the EHR practice management system, which is the user side of the platform. However, if you are going to do any administrative type of work in terms of changing settings and making updates to templates, then you would select administration. We will go ahead and log in as a provider into the EHR system, and to do so, we will select login. Preference for login view. In order to set the preference for the type of login view that you would like to see, you would go to Tools, Preferences, select User Preferences, and then under the General tab, which it opens up to the right-hand side, you will see Default Screen. You select that, and then if you would like to be able just to open up a chart right from the login, or if you'd like to have your practice dashboard or personal dashboard or the scheduler, these are all options that you can go ahead and have open up for your login. And you would make that selection and click OK.